Good morning. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and it's an honor to be joining my colleague, Dr. Shannon McDonald, this morning from the First Nations Health Authority. I want to start by recognizing that we are on the traditional territories of the Lekwungen-speaking peoples, and we're very grateful to be able to talk to you from this beautiful land today. As we know, COVID-19 has brought many challenges to our province, and with that, there has been fear and anxiety, with an urgency to do whatever may be required to protect our communities and our families. And for Indigenous peoples, the apprehension is particularly understandable, given the differential impact that past pandemics have had on Indigenous peoples in BC. Over the last few months, I've had the privilege of meeting with many First Nations and Métis leaders who have shared their concerns and those of their communities with me. Along with my colleagues at the First Nations Health Authority, we continue to meet regularly and to hear from Indigenous leaders, and I'm very thankful for that opportunity. We also recognized very early on that to be able to understand the impact on First Nations in British Columbia, we needed to have the data to understand what was happening. And because of that, I compelled the collection of the data and the linking of the First Nations client file so that Dr. McDonald and the First Nations Health Authority had the data that they needed to be able to understand the impact and to support our communities across BC. So with that, I'm going to introduce Dr. Shannon McDonald, the Chief Medical Officer with the First Nations Health Authority, to provide you with some information and the update on the data that we have about the impact on First Nations people in BC.
Good morning. Let me start by thanking Dr. Henry for inviting me here today to tell you about how BC First Nations have responded to the COVID-19 outbreak, and to thank her for her leadership during this outbreak and her commitment to protecting our First Nations people and their communities. I want to acknowledge that I'm here representing leaders and team members, especially a surveillance team from the First Nations Health Authority, who have done amazing work in challenging circumstances. I'm also pleased to tell you that thanks to an extraordinary response from our First Nations communities, the people FNHA serves have fared even better than the rest of the population in the face of this unprecedented challenge. First Nations Health Authority is unique in Canada in that through our long-standing partnerships with the province of BC and the federal government, we are able to link our First Nations client file, which identifies status First Nations people, regardless of where they reside in BC, and link that status with provincial data sets to provide a clear picture of the number of First Nations people who have been tested positive for COVID. From January 1st to June 14th of this year, just 87 First Nations individuals have tested positive for COVID-19. There have been 4 deaths. But right now, we only have 3 active cases in the province. Of the 87 First Nations individuals, 42 live on or near a reserve. This is out of more than 5,500 tests that have been done so far. The credit for this relative success must go to the choices our First Nations leaders have made to implement strong public health measures. Communities have made unnecessary travel very limited and canceled or postponed large gatherings that are central to their culture and way of life. The sacrifices made, some of them very difficult and painful, have paid off. The worst, which many anticipated and feared, did not happen. Transmission of the virus within and between our communities was kept to a very small number. Many band offices closed their doors and had their staff working on urgent matters remotely. Many communities stood up emergency operations centers, and some went into lockdown, restricting non-residents from coming into the community except for essential services. work to assure safety and food security were important tasks at this time. Despite this success, however, this is no time to lower our guard, even as the province transitions and begins to reopen, to allow the gradual opening of schools and businesses and travel. First Nations continue to express concern about having non-residents on their territories and potentially bringing the infection to their communities. But we will continue to work with them to do what we can to prevent that from happening. The curve has flattened, but it has not flatlined. If we relax our precautions too quickly, we could see a surge in cases. And this is why FNHA's recommendations remain in place. Maintain physical distancing, wash your hands frequently, and avoid gathering in large numbers. We must continue to do this for a while longer for the sake of the most vulnerable among us, especially our elders, our language holders, and knowledge keepers. In the meantime, we continue to work with our partners to evaluate the work that we've done to strengthen our response for any future active phases. With our health system partners, we are facilitating expanded testing to anyone who needs one so that we're not missing clusters or outbreaks. This means anyone exhibiting COVID-19 symptoms can now be assessed and get a test, even in the most remote communities. We also recognize the unintended consequences of what we've done. For those individuals struggling with anxiety and depression and loneliness, which is happening to a lot of us in these difficult circumstances, remember that our First Nations history has shown us how resilient we are. First Nations have always adapted well in the face of adversity, change, and even tragedy. I know we can get through this by supporting each other, by holding each other up, and by doing it with loving kindness. In closing, I'd like to thank my team members, all our provincial health authorities, the Ministry of Health, and Dr. Henry for their firm support for our First Nations needs and their commitments to address them. Thank you very much.
Today's announcement is welcome news for all of us. From the very outset, the First Nations Health Authority has put in an incredible amount of work into having the right tools and resources in place to protect BC's First Nations communities in the face of COVID-19. From data to lab testing to ensuring First Nations communities have response plans that actually work, that have the ability to support people if they needed to isolate, and arrangements for sharing of needed information with community leaders have supported that work. The data from the First Nations Health Authority tells me that the work that the FNHA, health directors, community leaders, and the communities themselves to prepare for and manage this pandemic is working, and we need to continue to support that work. I'd also like to make particular note of my colleague in my office, Dr. Danielle Bain-Smith, who has been integral in ensuring Indigenous voices and concerns are heard in all aspects of our response. There have been many challenges with COVID-19 so far, and there will be more to come. We just need to think about the impact on First Nations elders and knowledge keepers and the deep tragic loss that has for all of us. What I know is that together with Dr. McDonald, Dr. Bain-Smith, the First Nations Health Authority, and all Indigenous leaders, we will continue to do all we can to support communities to stay safe. We have seen the strength of working together, listening to each other, and finding solutions that meet the needs of each individual community. This will hold us in good stead for whatever lies ahead. Whether on the coast or in the north or the interior or in the lower mainland, communities need to do what's right for them at the pace that's right for them. And for many, including me, it is a slow and cautious approach is the way to go. Our new normal for this COVID time is very different from last year. But the precautions we take and the measures we have learned in the last few months will keep all of us safe in the coming months. As we look ahead, I know we will get through this by working together and by supporting each other with compassion and with understanding. We need to take that into our summer and ensure that we do travel with respect. Plan ahead. Understand why some communities may not yet be ready to have visitors in there. Find out what is open so that you can make the plans that you need and not put an undue burden on smaller communities in our province. We know that we can do this, and we know that it will be a challenge coming up, but together we can face that challenge, and we will continue in our time to be kind, to be calm, and to be safe as we move forward. Thank you very much, and we're happy to take questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone, please press star 1 to enter the queue. If you have already pressed star 1 to enter the queue, can you please re-enter star 1? Please unmute your phones. You will not be audible until we call your name. You are limited to 1 question and 1 follow-up this morning. Our first question is from John Seacrest, News 1130.
Thank you. My question is for Dr. McDonald. Just mentioning that you're crediting, the extraordinary response to why the Indigenous communities have fared better here. I'm just curious, are there any aspects of that you think worked better than others? It sounded like you mentioned limiting travel seemed to be really key in helping limit the spread here.
Thank you for the question. I would agree that limiting travel was significant. I think the other piece that was significant was the conversations communities were having with those who normally travel in and out of the community. They may be service providers, they may be family members, and others who, or people who are making deliveries. Those kinds of activities, the essential activities, were quite limited and under strict control, so that the possibility of transmission was reduced. There were challenges, and we had one community cluster that resulted because of an individual who left to go to work in a neighboring community and returned. But once that was acknowledged, things were put into place to really limit the spread in the community, and it was successfully kind of stopped in its tracks. So we're very glad that that was the case. And it reflects why communities are particularly concerned right now about others coming into the community who may not be taking the same precautions.
John, do you have a follow-up?
Yeah, thanks so much. And as we were just talking about that, I mean, earlier in the week mentioning phase 3 and moving into that. So I'm just curious, I just want to make sure I get the right message here. Are you hoping to see people return to some of these communities that might have been kind of closed off during the pandemic, or are we still, in terms of First Nations communities, remote ones, that type of thing, are we still urging people to stay away, or are these things, are we hoping people will return to those areas now?
My role as the Chief Medical Officer is not to politically control communities, but to respect their self-determination. Each community will be doing their own risk assessment and making decisions about the choices about people coming in and out of the community or traveling through the community themselves. And we continue to have conversations about how to best support the decisions that communities are making.
Next question is from Fran Yanor, the GOAT.
Oh, hi. Thank you, Dr. Henry and Dr. McDonald. My first question relates to youth in the North. The Minister of Education said the primary motivator for reopening schools was concern for student disengagement and loss of learning. And there's been, as I'm sure both of you are aware, numerous reports about Northern students and Indigenous students specifically, lowest levels of connectedness to their school, certainly Indigenous young people and youth, 4 times the suicide rate, lowest high school graduation rates provincially across the North. And that was before the pandemic. I'm just wondering, Dr. McDonald, how concerned are you about, particularly for the more vulnerable students who didn't return to class in June, about this break from school that might be kind of essential to their well-being?
I'll start off and then I'll let Dr. McDonald answer. But, that is one of the things that we were most concerned about when in-classroom schooling was suspended in March. And one of the really important reasons why we felt it was absolutely essential to have that support in classroom in June, so that we could learn about how do we best support many different communities. And you're right, particularly in the north, where things like internet connections can be tenuous. Those are challenges, and we know that many schools, however, in the north and in the interior and other places, went to extra efforts to connect with the families and communities in their schools. And I've witnessed some of that, and it really was a way, a different way of connecting with young people who needed that support. But yes, it is a particular concern. We have been making good progress in supporting Indigenous youth in completing school, and the high school completion rates have been going up in the past few years. So we don't want to lose that positive gains.
Yeah, what she said. Many communities, parents, and leaders have expressed the same concern. And we have many students who have remained very well engaged. The First Nations Education Steering Committee and others have worked very hard to increase access to computer equipment where it's possible, to have Wi-Fi connection and continue that work. There have been deliveries of school supplies and workbooks and other sort of things to communities to support students in continuing the work. But I also know that our students, as all children are incredibly resilient. And given the opportunity in the upcoming term, there will be opportunity to catch up, to continue to be engaged, and to succeed. As Bonnie said, the numbers of students in First Nations communities who are graduating is increasing steadily over time, and we certainly hope that that continues.
Do you have a follow-up, Fran?
Yes, I do. I just wondered, it's sort of on the same, actually, there's less than 30% who returned to class provincially. I just wondered how many returned to in-class instruction, and how many under 19s were actually tested positive in the FNHA area.
Sure, I'll ask Shannon to get that data from you, for you. Yes, there was about 30% overall, but it varied in different communities, and it was up to 60-70% return to class for some communities. So again, it reflects different community strategies and supports that are available in different schools. I don't have the exact numbers of who returned in specific communities, but I'm sure the Ministry of Education can provide some of that information. I will say, we are learning from what happened in the last month. The last day of school official day of school was yesterday. The Ministry of Education has put together a task force to look at how things worked, what things worked and didn't work, and how we can best support many different models of schooling for the coming September school year. So that's going to be really important for us to understand and learn from what we went through in the last month. The one other thing I will mention before I turn it over to Dr. McDonald is there has also been, I've been really heartened by hearing many stories of how First Nations communities have been taking the opportunity to go back to the land and bring their children to learn different traditions around going out in the land and understanding how that, the medicine and the learning that you can get from doing more traditional things in their communities through this time.
Thanks, Bonnie. I think that's really important to recognize that opportunities to learn about traditional foods, traditional medicines, language have not been lost during this period of time. With regard to the numbers, under the age of 10, we've had no cases at all. And from 10 to 19, we've had 6 cases. So very low numbers indeed.
Next question is from Richard Zussman, Global News.
Dr. McDonald, this is for you. What's being done to address some of the concerns that Indigenous communities have raised about wanting more resources to do temperature checks or other COVID-19 tests as the economy reopens?
Thank you for the question. And they're really two different things. One is screening, so looking at the population both in community and visitors to the community, where things like asking health questions. I get on the ferry and go back and forth all the time, and they ask me if I'm feeling well, if I've had any symptoms of COVID. They have not taken my temperature, but that is their screening tool. And there have been discussions about continuing to do that in community, and the health staff are available to support communities to do that. We partner both with the federal government, so Indigenous Services Canada, First Nations Inuit Health Branch, and Emergency Management BC in terms of funding work that gets done in community. Some of the communities that went into lockdown, for example, communities did have federal funding available to support those activities. So it's not First Nations Health Authority who has responsibility for those, but I certainly support the community desire and will help them design anything they want to do.
Richard, do you have a follow-up?
I do, for Dr. Henry, and completely unrelated, and I apologize. Dr. Henry, I'm getting a lot of emails recently about casinos, and I know this has been a high concern of yours, but there also seems to be a plan to start getting them reopened in British Columbia. Can you give me a sense of what your advice is around casinos, and is your sense the province is poised to figure out a way to reopen them before we get to phase 4?
So can I take advantage of the question you asked Dr. McDonald to add one thing to that, in that we've been working very closely with First Nations Health Authority, the BC CDC, and our laboratory. One of the very concerning things was access to testing. So we have had we've had the ability to purchase with First Nations Health Authority testing equipment that we have pre-deployed in more remote areas. And so that's one of the things that we're doing to make sure that rapid testing is available to all First Nations communities across the province. As well, the Ministry of Health has been working very closely with communities to ensure we have a transport network that allows people to get the health care they need, whether it's from COVID or anything else, across the community, across the province as well. And those are really important measures that help support communities in this transition time, but also going into the fall. In terms of casinos, yes, that is something that they are working on. I did have concerns, and we did close casinos, as you know, quite early, partly because of, we know that large numbers of people in indoor enclosed environments with poor ventilation, particularly people who are older or more at risk, and some people who attend casinos on a regular basis fit into that. I know they have been working with WorkSafe BC to determine if there's a way that they can open, taking those into account, and they're developing protocols. I have not yet seen them, but I know that that is one of the areas that they're looking at that meet the guidance that we have to ensure that they can operate safely. So again, for casinos, it's not just the patrons, it's also to ensure the staff at the casino are safe as well. So I understand that's underway. I have not yet seen the details.
Next question is from Moira Witten, the Tyee.
Hi, good afternoon. Thank you very much for this presentation. My question is for Dr. McDonald. We're hearing that First Nations leaders are saying that they weren't adequately consulted for the phase 3 reopening. Are you concerned that further travel could undo some of the hard work they've put into protecting themselves?
First, I need to say that the decision to go to phase 3 is a political one in the role of the provincial government, despite any advice I might give or anybody else might give. The decisions are made at other tables, but they're made very carefully. Am I concerned? Absolutely. And Dr. Henry has said previously that we know there will be cases We're hoping, of course, that those cases are not among First Nations people, and that's why our recommendations about physical distancing and hand washing and not gathering in groups and making sure surfaces are very clean, especially in service establishments, et cetera, that those pieces will be in place to protect communities. And some communities will choose not to welcome guests. And as I said earlier, they have self-determination. They are self-determining nations, and they can make those choices, and I'm not going to disagree with them.
There has been an ongoing process, and we recognize the concerns and the challenges that all of us face. And I know that the Ministry of Indigenous Relations, as well as Public Safety Solicitor General, Health, and many others have been meeting on a regular basis to ensure that we can have those partnerships. We can make sure that the needs of communities are addressed and respected. And I know we have met regularly with leaders to make sure that we have the supports in place to support them, whatever their decisions are about visitors and about challenges at this time.
Do you have a follow-up, Myra?
I do, thank you. Just quickly, last week we heard some very troubling allegations of anti-Indigenous racism in the healthcare system. Dr. McDonald, I'm just wondering if you can share a bit how the First Nations Health Authority is working, how it is contributing to the investigation, the actions taken as that unfolds.
Yeah, I just want to say that, you know, this is something that has saddened and angered us. We continue to be very involved in ensuring that Mary Ellen Terpondlefel has what she needs. We will be involved as well in supporting that investigation, but First Nations Health Authority.
Thank you. As an individual, I'm shocked and saddened. As a physician, I'm disgusted, but not surprised. And I think that's very much the response that our nations have brought forward. We know, because my phone rings at least once a week with, if not that complaint, another complaint about people who feel they have not been well treated because they are Indigenous, or people who have received less than adequate care because they are Indigenous. We know that this instance is really the tip of the iceberg. And while we absolutely support Mary Ellen Turpel-Lafond and her work, and the ministry for responding so quickly to the incident in question, we know that there is much, much more work to do. And we have been working for a long time in the area of training people in cultural safety and humility, and working with the universities, with training programs, with health authority staff, and we have pretty succinct agreements about how we're going to work together to change that. So when a situation like this arises, we are saddened, we are disappointed, but we are not surprised. And we are all committed to work together to make change.
Next question is from Lisa Cordasco, CHLY.
Yes, good morning. Thank you. What does your data tell you about geographic cases? Did you find that there were more cases, for example, near urban centers or not?
Well, as I stated, of the 87 cases we're reporting, 42 of them are on or near reserve. We have cases in every health authority region. We've had a couple of spikes. There was a cluster of community transmission on Vancouver Island that people are quite aware of, I think. There was a cluster at the Mission Correctional Facility that included a number of First Nations individuals. And the urban centers, not so much urban centers, but urban regions, I guess. The provincial data represent a significant number. Remember, we're talking really quite low numbers. So it exists in every region. There have been a couple of small blips, but for the most part, we're talking about 10 communities that have been affected, and most of those communities have had 1 or 2 cases. They've done very, very well, except for those couple of little blips. Thanks.
Lisa, do you have a follow-up?
Yes. In terms of First Nations not wanting travelers, not just on reserves, but in the territories, what sort of steps might be taken for people who, might not even know they're traveling through territories? Do you expect to see signage, or what sorts of things might people be able to recognize, where they should or shouldn't be?
Yeah, so these things are being worked out. In some cases, there are signs that restrict, and there's protocols and barriers in some communities to prevent people from coming. Of course, we know that the major provincial highways go through some First Nations communities, and those are essential for ensuring we get goods and services to many communities around the province. So there is work going on between government and First Nations to negotiate how that all will work. But really the message to people is know where you're going. And this is for all communities across BC, because we know that First Nations communities, but other communities as well, are more or less prepared to welcome guests and visitors this summer. So check ahead if you're going, particularly if it's a smaller community. Many of our communities are quite anxious and looking forward to welcoming visitors. So we need to take it upon ourselves to make sure that we're using our travel manners that we've all learned, the things we're doing at home. We need to take with us when we're traveling. We need to check ahead, find out what's open, find out what's available, if you need to be more self-sufficient for some communities. So those are the things that we're asking everybody to do in BC this summer. I don't know if you want to add.
Dirk Meisner, Canadian Press.
Hi, thanks. Dr. McDonald, can you elaborate or explain what do you think is behind the huge buy-in in Indigenous communities to follow the health recommendations?
History is an ugly thing for many First Nations communities. We have people alive and well who tell the stories of previous pandemics, of Indian hospitals, of TB, of losing people in those circumstances and losing control. That kind of response, that fear response, that internal memory of those things makes people extremely aware. I think culturally as well, we have so few elders now who are knowledge holders and language keepers, and communities are very aware of their importance in community and the need to protect them. Being able to continue to support families and communities is our work, and we have heard very loud and clear from those communities that they are determined to protect individuals, families, and communities as much as they possibly can.
Do you have a follow-up, Dirk?
Sure. I'd also like to ask Dr. McDonald if what happened early in Alert Bay, the cluster there, did that spur people to be even more vigilant on their the health restrictions? Absolutely.
I think some of our remote communities had a feeling that, oh, well, it's not going to come to us. And to have it come to a relatively remote island off the north of Vancouver Island was eye-opening. I know the community I live in became much more aware and communicated much more strongly with members of the community about social behavior and going back and forth. It really changed people's view of the risk.
We have time for one more question this morning, and that comes from Binder Sejjan, CTV.
Hi, Dr. Henry. I wanted to ask you about this legislation that is proposed by the NDP government with regards to stabilization care for young people who overdose. The chief coroner has come out and said that without evidence-based, accessible substance use treatment services, that there is a potential for unintended consequences, including an increase in fatalities. And I'm just wondering what your thoughts are on this.
Yeah, so this is something that I'll be working through in some detail with the Ministry of Mental Health and Addictions. I also have concerns about the fact that we still are having challenges. As you know, we've put a lot of time and effort and attention to trying to build up the services that we have in communities, particularly for young people around addictions and substance use, but we still have a long ways to go. The positive things are the Foundry organizations that we have now around the province, and those are a place where youth can reach out and get help that they need. I will be working very closely to ensure that we have an evaluation of this so that we ensure that there's not unintended negative consequences and that this is something that may actually benefit young people. It is a very difficult balance, and so yes, there's a challenge with evidence, there's a challenge in understanding how this is going to work, and the resources that are available in the Lower Mainland, for example, are different than in other parts of the province. So I will be working with the Ministry of Mental Health and Addictions to ensure we have a robust evaluation so we can determine any of the positive or negative consequences of this change in legislation.
Do you have a follow-up, Binder?
Yes, and because it's Friday, I wanted to ask how social media savvy you are and if you're looking forward to taking over Olivia Munn's social media account.
Yes, I'm not particularly social media savvy, I have to admit, but I'm really excited about this and had a great opportunity to develop some messages that will be coming out today, and really it's about solidarity, and it's about the fact that all of us are dealing with this unprecedented time. And we've talked today about the things that we need to do differently because of COVID-19 in communities that have had traditionally been differentially impacted. And when we do work together, it works. We can make a difference. And so that's the messages I'll be talking about. I'll be talking about things like we are all in the same storm around the world. And it really is, however, different boats that we are in, and we need to be compassionate, and we need to reach out, and we need to do this together as a global community as well as a community here in BC. So I'm really kind of excited about it, and there are other more tech-savvy people who will be helping me, so that's the good news. So, thank you very much.
That's all the time we have. Thank you.